Just right there with our KUAM News Decision 2020 candidate interviews. But of course, in the midst of a pandemic, we're seeing a increase in the number of positives. The deaths keep coming. So we want to make sure that COVID is a big part of our conversation every morning. That being said, Lillian, thank you so much for coming on and blessing us with your time.
Yep.
We'll just get right into it. The COVID census, we saw a big spike in admissions yesterday. Unmute.
Yes, the numbers are rising. As of this morning, it is 44. We have 44 individuals in the house with COVID infection. And of the 44, 15 of them are at the ICU level of care. And of the 15, 7 of them are on ventilator support. So that's where we stand right now with our COVID statistics in the house as of today.
Lillian, it seems like just the other day you were reporting hospitalizations under 30. What happened, and can you give us any more info on the traffic that's come into the hospital?
Just that they continue to come in, individuals, I don't know if they were tested positive, part of that population that, public health, the JIC releases at the numbers, or that they just come in with symptoms, and then when they are tested in the emergency room, the results are coming out positive. So
Right,
that's what's happening. They're coming in.
Right, and I remember what you said when we spoke to you last, when the number was, I think, 82 or something over the weekend, and you said you guys got to prepare because there's a probability that almost 10 or something like that, 10 or 20% would make their
10,
way
20%,
right,
10
would
to
make their
20%
way
come.
over to GMH.
Yeah. Uh-huh.
Can you give us?
So-
Oh, good. Go
Well,
ahead.
we're just again seeing the numbers, people coming in with the infection.
Can you give us any additional info on the COVID-related fatalities that we've had since the last time we talked to you?
No, I mean, other than what's already shared and published in the JIC, really, there's not much any more information that, that I can release, so I don't have any more other than, what's published already in the JIC.
Right.
And, these are essential information that, the community needs to know
Lillian,
that we continue to use.
with the admissions, can you give us maybe our patients coming in? Because I know we've been talking over the last few weeks where you were saying that a lot of people are waiting too long to go to the hospital.
Not so much that they are waiting too long, but we're seeing that, they've had the symptoms for several days. And so, or even a week. Some of them think that they're just going through the flu symptoms. So yeah, when they wait, when they delay getting treatment right away, it affects their whole system and how they can recover. So, again, I'm just going to encourage people, continue wearing your mask because, it does show that when you don't wear your mask, this virus is airborne, and it can last minutes to hours in the air. So that's where it gets transmitted. So people, please continue to wear your mask. And not wait too long. When you start feeling the symptoms, get medical treatment at a clinic or a public health clinic, or where you can get, where you normally have your primary doctor, where you normally get seen. Be seen as soon as you can.
Lillian, I just wanted to ask you about how your staff is doing their health. I know, I think I read a headline somewhere about 60 GMH employees. Is that correct?
It was 60 total number of staff who tested positive, but majority of them have recovered and have returned back to work. So yes, that was the number that's the latest, was about 60 total staff that tested positive. Yes.
And that's since the beginning of the pandemic, correct?
Second wave.
Right. Yeah. So you have been giving us those updates. So
Yeah.
I appreciate that. Lillian, the statement just came out from the governor's office. It was about 3 paragraphs worth of statements. I'm just going to read you the relevant part. The governor has been clear that our policies will be directly linked to the data we have. She's especially concerned about the increase in new cases, the increase in hospitalizations, and the increase in COVID-related deaths. For these reasons, she will not be lifting any additional restrictions this week, and the island will remain in PCOR 1 with a safer at home advisory. Just as the head of the hospital, like you said, we're seeing the numbers climb. This is an area of concern. Do you think that the not lifting any more restrictions will give you guys a little bit more breathing room? And are you anticipating an even further surge in admissions and ICU level care for people with COVID?
Again, it's not really because, we don't want people to come to the hospital, but the restrictions that the governor is continually enforcing, it's really for the whole community. It's for the protection of the whole community and to really minimize as much as possible the transmission of this infection. And so, but the hospital is here. Whoever needs to come and be seen, we are here and we will accommodate you. But it's really for the general public, for the protection of the general public, that the governor continues to, encourage and minimize, the possibility of spreading the infection by, again, enforcing social distancing and, people wearing their masks, minimizing the possibility of people congregating. And, that's really the goal, is just to try and minimize this spread of infection, the transmission of this infection.
Right, yeah. It's just that she had mentioned the increase in hospitalizations as one of the factors, right? And not easing restrictions.
Okay. All righty.
Okay. No, I can call her for updates on that
Okay.
stuff.
Thank you so much, Lillian.
Thank you.
Appreciate your
Take
time
it
this morning.
care.
Stay safe.
You too.
Thank
Okay.
you.
There's some
Take it
virtual empanada if you want to get some on your way out.
Oh, I like that. And the lobster that Chef Peter Drain.
I know, right? So that was your
Yeah.
stomach growling, I heard.
I'll just take it and eat it at home with my husband.
Go ahead.
There you
Balut 10
go.
to go. All right. Thank you, Lillian.
Alrighty.
Esta.
Bye.
9:14. Take a short break. We're coming back with KUAM News Decision 2020.